Welcome to a new episode of the Health Basket. I am Dr. Ramasubramanian. I am the Medical Director of Capstone Multi-Speciality Clinic in Nungambakkam, and I am a consultant infectious diseases at Apollo Hospitals, Chennai. This time we shall listen on and know a little bit about the novel coronavirus. There's been a lot of talk going about the 2019 novel coronavirus, and I think all of us would be interested to know how it impacts us. Around the 31st of December, there came a news from China that the doctors there had come across a cluster of cases of a new infection which was causing pneumonia in several people, and they were not able to identify what bacteria or virus was causing this problem. They found that most of the patients who came to them and presented to them had some connection with a seafood and a live animal market in Wuhan, a city in the Hubei province of China. And it was found that the people who presented to China with this typical pneumonia, which refers to basically an infection in the lung, had some exposure or had gone to the seafood market. Subsequently, a week later, around the first week of January, the Chinese authorities gave a second news. They identified this virus as a coronavirus, which was responsible for pneumonia in these people. Now, coronavirus, so called because it has spikes on the envelope of the virus, has been known for several decades. It is not anything new. It usually causes a flu-like illness, typically associated only with cold symptoms, because the virus affects only the upper respiratory tract, which is the nose and the throat. So people who suffer from this infection present with cough, cold, blocked nose, runny nose, maybe a little feverish feeling, nothing more than that. So it is in general a self-limited, simple, uncomplicated disease. But when they identified this coronavirus in the people who presented with pneumonia, which essentially means that the coronavirus had mutated or had changed to infect the lower part of the respiratory system, which is the lungs. And when it caused a pneumonia, it can lead to serious consequences and even death. In fact, the first death was reported around the 10th of January in one of the patients who was exposed to the Wuhan seafood market and subsequently developed this illness. The Chinese authorities went on to analyze the virus and found that this virus was a coronavirus, again, which had mutated to become pathogenic and cause pneumonia in man. Let me tell you a little bit about the coronavirus. These are viruses which are normally found in animals and birds generally and can cause, as I said, in man a cold-like illness. But in the past, mutations in the coronavirus has had serious consequences. In the year 2002-2003, the same coronavirus had mutated and caused an infection known as SARS, which is severe acute respiratory syndrome. This SARS epidemic involved over 8,000 patients all over the world. It started in Hong Kong and spread through all over the world due to people traveling and led to the death of almost 800 people, thereby causing almost a 10% mortality. Investigations at that time revealed that this coronavirus had originated in bats and subsequently had passed on to civet monkeys, and from civet monkeys, because of a close contact with humans, had jumped the species barrier to infect man. There were several healthcare workers, doctors and nurses who died because of this infection. Fortunately, it was well controlled because of diagnosis and isolation.
மேலும் பல மருத்துவ குறிப்புகளை சிறந்த மருத்துவர்களிடமிருந்து பெற ஹெல்த் பாஸ்கெட் யூடியூப் சேனலை சப்ஸ்கிரைப் செய்யுங்க. தொடர்ந்து நோட்டிஃபிகேஷன் பெற பெல் ஐகானை கிளிக் பண்ணுங்க. மேலும் பல உடல்நல குறிப்புகளை பெற ஹெல்த் பாஸ்கெட் சமூக வலைத்தளங்களோடு இணைந்திருங்க. Let us join hands to make this world healthy.